All right, welcome. Today, we're going to demystify childhood asthma. We're going to turn all that complex medical jargon into something really clear and easy to understand, all based on the fantastic insights of Dr. Adel Alharbi. We'll break down exactly what you, as a parent, need to know. Okay, so let's just jump right in with a big question, right? Why does my kid cough so much at night or right after they've been running around playing? This is usually that first little red flag that gets parents worried, and honestly, it's the perfect place for us to start digging into what's really going on inside their body. So to really get a handle on that cough, you gotta first appreciate just how incredible our respiratory system is designed. I mean, it's not just a bunch of tubes for air to pass through. No, it's way more sophisticated. Think of it like a high-tech air purification plant. So picture your child's nose and sinuses as this amazing built-in filter. Its job is to clean, warm, and humidify every single breath before it even gets close to the delicate lungs. It's trapping all the gunk, pollutants, germs, dust. It really is the body's first and most important line of defense. Okay, so that's how it's supposed to work. But what happens when that very same protective system gets triggered in a child who has asthma? Well, the change is it's dramatic, and it happens incredibly fast. Let's really look at what's going on. Wow, the difference here is just night and day, isn't it? On one side, you've got a normal airway. It's like a wide open, clear superhighway for air. Easy breezy. But then look at the other side. During an asthma attack, that highway turns into this narrow, blocked, and inflamed tunnel, completely clogged up with thick mucus. It's swollen, it's constricted, and it's a real struggle for any air to get through. And, this whole thing doesn't happen slowly. Not at all. It's like an explosive chain reaction that can go off in seconds. First, a trigger gets in. Could be just a speck of dust or pollen. The super-sensitive cells in the airway just freak out and sound the alarm. Then, the body floods the area with thick mucus to try and trap it, and at the same time, the muscles around the airway just clamp down, squeezing the whole thing shut. Boom. This leads us to a really, really crucial point. That cough? It's not the actual disease. It's the body's desperate, forceful attempt to clear out all that mucus and blast open those blocked airways. So trying to just stop the cough without dealing with the inflammation, well, that's like turning off a fire alarm, but letting the fire keep burning. It makes no sense, right? So if the cough is the alarm, what's pulling the trigger? It's the immune system. And understanding why it's doing this, well, that brings us to what might be the biggest mindset shift for any parent dealing with asthma. There's a huge misconception out there, and once you get it, it changes everything. And here's the core idea, which Dr. Alharbi puts so perfectly. Your child's immune system isn't weak. In fact, it's the total opposite. It's overactive. It's overprotective. It's launching this massive, all-out defense against what should be a minor threat. It's, as he says, a panicked overreaction. And this right here explains why antibiotics just don't work for asthma. An asthma attack is the immune system overreacting. It's not a bacterial infection. Antibiotics are designed to kill bacteria, so they're completely useless against this kind of inflammation. Getting this distinction is so key to avoiding medications that your child just doesn't need. Something else that's really important to get is that asthma in kids, it's just a different beast than what you see in adults. They're not the same thing. And understanding this difference is so, so important. And honestly, it offers a lot of hope for families. So just take a look at the key differences here. For kids, asthma is often episodic. Maybe it flares up with the seasons. But for adults, it's usually a more chronic, persistent thing. But here's the part that really matters, the part that gives so much hope. A lot of kids actually outgrow their asthma. That's something you just don't see very often in adults. Okay, so how common are we talking about? Well, look at this number, 28%. That's the recent statistic for childhood asthma prevalence in Saudi Arabia. And believe me, that number tells a really big story. And to put that 28% into perspective, just look at this trend. Back in 1995, the rate was around 8%. Today, it has soared to 28%. I mean, that's not a small jump. That is a massive increase, and it points a huge finger directly at the growing impact of things in our environment and our lifestyle. So what's behind all this? Well, it's rarely just one single thing. It's more like a perfect storm. It usually starts with a genetic predisposition. Maybe it runs in the family. But then that genetic potential gets switched on by something in the environment, like smoke or pollution, or maybe even a really bad viral infection when they're little. Okay, so we've talked about what it is, what causes it, and how it works. That can all feel a little overwhelming, right? So the big question is, how do you, as a parent, move from a place of just reacting and worrying to a place of proactive, confident control? The answer lies in having a clear strategy. And Dr. Alharbi lays out a fantastic 5-step plan to do just that. Step 1, get the diagnosis right. That's everything. 2, create a personalized treatment plan because every kid is unique. 3, educate everyone, the family, the child. 4, have an action plan ready for when an attack happens. And finally, number 5, which is maybe the most important, focusing on prevention and avoiding those triggers in the first place. And when we talk about prevention, here's a golden rule you have to remember. You absolutely cannot control the lungs if you don't control the nose. They're one connected system. Think about it. The nose is the front door to the lungs. If you have uncontrolled allergies in the sinuses, all that inflammation and all those triggers have a direct highway down into the chest. So managing the nose is critical to protecting the lungs. You know, we live in an age where you can find an answer to anything online in seconds. But Dr. Alharbi has a really critical warning about this. Please do not take medical advice from unverified social media sources. There's just a flood of bad information out there. Some of it is useless, some of it is downright dangerous. Your safest, smartest, and most effective path is always to consult a trusted medical expert. And that really brings us to the final, most empowering thought. When you have the right knowledge and a clear plan, how does that transform things? Well, asthma can stop being this big, scary thing that causes fear and anxiety. Instead, it just becomes a manageable part of life. And that's the whole goal, isn't it? To make sure your child can run and play and just live a full, active, joyful childhood, completely without limits.